discussing doctor and manager-caregiver interaction in the healthcare setting. Manager-caregivers are high in conversation and high in conformity. This means they can prove a challenge in a medical setting because they are overbearing and can be authoritative, making decisions in place of the patient that they believe to be best. So why is this important? This is important because all patients, doctors, and caregivers have different life experiences which have shaped their communication styles. Dealing with different communication styles is crucial in creating shared meaning in the medical setting and making patients and doctors comfortable in the decisions that they make. Shared meaning not only creates better rapport between medical staff, patients, and caregivers, but also allows for important health information to be received clearly, allowing patients to feel more responsible and in charge of their health care. As scholars, we know that caregiving styles do not change because they're shaped by inevitable factors. Therefore, doctors become key to effective communication. They must adapt and try their best to conform to the caregiving styles and types of communication that the caregivers have. This is to ensure that the patient, first and foremost, becomes the center of attention and is comfortable in the healthcare decisions, not the caregiver. Our clip will demonstrate both effective and ineffective ways a doctor can deal with manager-caregiver and how this affects the patient and health outcomes.
Hi, I'm Katie. I'm your nurse. I'm taking your blood pressure today.
When will the doctor be in?
She'll be in momentarily.
Hi, I'm Miss Jones. I will be assisting you all today. What's your name?
I'm Haley.
Hi, it's nice to meet you. And you must
meet
be
you.
Mom.
Yeah.
It's nice to meet you. So what seems to be the problem today?
Well, she's been really congested and her head's been really hurting and she's just really fatigued and weak.
Okay. When did all of these symptoms start?
It started yesterday in the morning.
Yeah,
It's just progressively gotten bad.
Okay. What seems to be the worst symptom for you?
I think
it's
mostly the headaches. She's
Yeah.
complained about the pain in her head the most.
Okay. Well, it sounds like to me, just from your symptoms, and we'll do some other tests and stuff, but you may have a sinus infection, maybe a little case
Well, I
of the
looked it up on
flu.
WebMD and it has pneumonia. She has pneumonia from her symptoms and it said it can lead to lung cancer.
Okay. Look here, lady. I think that you're a little overstepping your boundaries a bit. I'm the doctor. You are not. I feel like you're kind of taking over my authority. So I'd really appreciate it if you just back off a little bit so I can talk with my patient. Okay. All right.
Okay. Hi, Haley. I'm your nurse. I'm going to take your blood pressure, okay? When will the doctor be in? She will be in shortly.
Hi, I'm Dr. Jones. What's your name?
I'm Haley.
It's nice to meet you, Haley, and you must be Mom. So what seems to be the problem today?
Well, she's been feeling really sick, and everything is in her lungs, and she's been coughing and sneezing and feeling really dizzy. And as you can see, the coughing is a problem.
Okay. When did this all start, Haley?
It started yesterday, mainly.
Yeah,
yesterday. And then it was really, it was a lot worse in the evening, and that's why I made the appointment this morning.
Okay. Well, just from your symptoms, it sounds to me like you possibly could have some kind of flu
Well, what
or
we were
sinus
thinking
infection.
is that it was something really serious because I looked up a lot of the symptoms online, and I just wanted what's best for her.
Okay. Well, as much as I value your opinion, and it sounds like you've done some great research, let me ask Haley just a few direct questions so I can get more of a feel of her pain tolerance, maybe how this time compares to some past times, and we will get back to your previous issues and concerns, okay?
Sounds good.
Okay, so, Haley, what seems to be worst to you? Like, what feels the worst? Your nose, your throat, your chest?
I'm really congested. Like, I can't breathe at all. Like, I'm coughing. It's all coming in mucusy. It's nasty.
Okay. Are you experiencing any pain or discomfort?
Yes.
Yes. On a scale of 1 to 10, give me your discomfort level.
I'd say about an 8. Like, my body just aches. It just hurts.
Okay. All right. Well, I think I have enough information. I'm going to go and grab your blood work, Haley, and I'll be back so we can talk about your diagnosis, okay?
Okay, perfect.
All right.
Thank you.
Thanks.
So So as you can see from the first video, the interaction between the caregiver and the doctor became tense and uncomfortable and unpatient focused when the doctor didn't accommodate the communication style of the caregiver. In contrast, the second video showed the doctor using shared meaning to create a common goal and refocus the attention on the patient. While we know that manager caregivers can be difficult to deal with and overbearing in doctors' roles, it's important to note that the health outcomes are more positive when the doctors accommodate to the styles of the caregivers and refocus on the patient's needs.